So away from parliamentary matters, let's take you through some health matters now as we go into Kakaki Cancer Awareness Program. This time we'll be talking about beyond survival, thriving in the face of adversity. The host of this particular segment, Dr. Dennis Ajo, will be taking over now. Doctor, good morning and welcome.
Morning, Dr. Denise.
Good morning, guys. How are you?
We're
Good,
good,
good.
and you're looking good as always. So
In
you
fact,
take
I'm
the
feeling
floor.
it. I'm getting to the spring weather.
Okay.
Oh, great. Okay, you have the floor now, please.
Thank you. Morning, viewers. Welcome back to another edition of Kakaki with Dr. Denise Ejo, the CEO of Common Cancer Foundation. Together we fight, together we win. Thank you all for championing our cause as champions this 2025. So let's all continue to be there. That's how I want to start today. So good morning and welcome back to having you on air. What are we talking about? Beyond survival, thriving in the face of adversity. Today, I am very privileged, I'm going to put it that way, to have someone very dear to me. Today, to talk. So, today, we bring you an inspiring story of strength, resilience, and impact. It's a conversation that goes beyond survival. It's about thriving in the face of adversity. Thriving. Please note some of my keywords today. So, who is my guest? My one and only dear sister, looking very beautiful this morning, Eniola Omoru Akitunde, who is the founder of the Nayola Cancer Care Foundation in Abeokuta. Good morning, my dearest.
Good morning, Dr. Dennis Ejo. Thank you so much. Thank you for having me this morning. Good morning, Dark Communication. Thank you.
Nice to see you. You're looking very nice. You're looking fresher than I am, I think.
Uh,
We're looking good.
Thank
Don't
you.
worry, we're looking good. Don't worry, we're
You,
looking good.
I told you when I first came on, before we came on here, I told you that you are an inspiration and you're looking more beautiful. And I really thank God for your life. Thank God for your life.
We all thank God for our lives. Thank you. Thank you very much. You're making me blush. Let's start. So let me tell you all about my guest. My guest today, as you will acknowledge, is a woman of remarkable talent and purpose. An award-winning jewelry designer whose creativity has captured hearts. But beyond the sparkle and elegance, as you will see, she's also a beacon of hope in the fight against colorectal cancer. As the founder and executive director of Neola Cancer Care Foundation Nigeria, Nigeria's first colon cancer awareness, she is dedicated. No, let me do that again. Nigeria's first foundation dedicated to colorectal cancer awareness and early screening. She has turned her personal battle into a mission to save lives. Our
Thank you,
focus
Dr.
today will be on how do we turn pain, or how did she turn pain into purpose? And I hope that will be an answer. I hope everybody will be able to think and reflect on that. And how do you rise above challenges and create a lasting impact? And most importantly, what we can learn from her journey as individuals, as cancer advocates, as patients, and as the community and Nigeria at large. So sit back and let's relax as we delve into the conversations with this powerful lady, Eniola. I'm going to call her Eniola throughout the conversation. I hope that's okay with you, my dear.
That's fine. That's fine. That's fine.
Together we fight,
Perfect.
together we win. Thank you all for joining me today. Let's all remain united against cancers we fight. Here we go. Now, my first question. Your journey is both inspiring and multifaceted. Now, a lot of people at the end, I will refer them to you or you will tell people about where to find that film. Okay, those series at the end. Okay, an award-winning jewelry designer and a passionate cancer advocate. So now, what motivated you to establish the Neula Cancer Care Foundation, and how has this personal story shaped the mission of Nayola and linking it with all the things all the other things you do?
Oh, thank you so much. Should I go ahead?
Mm-hmm.
Yeah, okay. Oh, thank you, Dr. Dennis Ejo, once again. I've said it repeatedly, as at 11 or 12 years ago, if I'm told I'm going to sit here this morning creating awareness, talking about colon cancer, I would have said it's not possible. And as at that time, 2011, there was no, in fact, I don't have any idea that there's anything in our body that it is called colon. I don't even have any idea. Yes, have I heard about cancer before then? Yes, I know, at least I've read some couple of I've seen some couple of educative material on breast cancer, cervical cancer, then the popular Pink Ball by Genevieve magazine. Then, I've, so I'm aware of breast, but not colon cancer. And so, 2011, I lost my child after waiting on the fruit of the womb. I had several miscarriages. Then I had this boy and we lost him. So after we lost him, then 2012, I noticed my husband was losing weight. But because of the adversity that we've passed through in the marriage, the trials and tribulations, and so many other things, like all this, there's no job has been on in Nigeria for God knows how many decades. So my husband does not have a job like that. And then coupled with losing a child after waiting on the Lord, having several miscarriages. So I thought when he was losing weight, I thought it was because of what we were going through in the marriage. I never knew there was something more serious than that. And so in 2012, he was losing weight, sweating profusely. When he entered the loo, it doesn't come out on time. And then at some point it became so worst. And that was when I traveled out. So he came to pick me at the airport. And he was calling me. I didn't hear him. Somebody tapped me. I said, "Are you not Eniola? Someone is calling." And I turned. Lo and below, my husband is dark. He has lost so much weight. He has changed. And I traveled just for 10 days or so. And I was like, but now what happened to you that I couldn't recognize you? He said he has not been feeling too well. But I said, okay, have you been eating? He said, no, that he lost that. But I said, you've lost so much weight and your color have changed. And that was how the journey started. We went to the hospital, they tested him, they did the screening, and they said he had typhoid, malaria, typhoid, the normal story. And then they started their treatment. Then it wasn't working. So they did all that further test. Then they said he has infection in his blood. And I was thinking it was all those normal infections that we normally have. We use augmentin, we cleared it off. The doctor will write an antibiotic and you use it and you're fine. So that was what I thought. And then the journey started. From there, they said we have to go for further screening. As at 2012, we spent over 250,000 then for the screening, and later the stomach became hard. It was still losing more weight. So after the screening, they said they had a tumor in the stomach that they are not sure which cancer, but they could suspect it's cancer. And I was like, cancer? Okay. At that time, I've not really understood. I can't really, I can't, I don't understand what we're dealing with. I don't even have idea at all. And then they did the surgery. I thought after the surgery we are done. After 3 weeks, they asked us to come back. Post surgery, we went back to the hospital. The doctor saw us and they said the next stage now is going to refer us to another hospital, Eco Hospital. So for chemotherapy, at that point, I still don't understand. I thought, oh, chemotherapy is just, okay, maybe we just go, they give us some drugs. They said they can't administer it. So we went there, we got to the hospital, and what I saw threw me off balance. I saw sort of people, some people were on wheelchair, some people cannot talk, some people, and we're like, my husband is still working. So what are we doing here? So they said the chemo section that they need to prep us up. So we went in for the prep talk. The nurse spoke to us and told us a lot about what chemotherapy means, what we're going to expect, how much it's going to cost. At that point, they said it was 310,000 there. And that is about 310,000 for every 10 days. And when they mentioned that name, my husband nearly passed out. That 300 every 10 days, where are we going to get it? We spent a lot on this. And I heard this and I told you, don't worry, we are going to go through. Yes, we did pull through. Then another thing I remembered, when we wanted to take the chemo, because when he was going through it, at some point I started reading books, talking to doctors outside the country. There was no NGO on colon cancer. There is no NGO I could talk to in Nigeria on colorectal cancer. So there was a gap on that. And the awareness was not there. And I needed somebody that I could talk to. So I was talking to doctors abroad and all that. And they told me that if my husband is going to take chemo, since we've not had a child, that there can be an opportunity to bank his sperm. So I discussed this with the oncology doctor that we were assigned to in Eco Hospital. The foremost oncology doctor is now retired. And when I mentioned it, when we had the meeting with him, how the chemo was going to happen and all that, he shut me down and he said, "We are thinking of rescuing your husband. You are talking about banking. You are talking about sperm and having a child." And I said, that I who had a child who lost it, and I was trying to share my story with him. And he said, "No, no, 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 that I shouldn't even bring it." He shut me down, and that was it. So they gave my husband the chemo. He took all the sections. He took all the section. He took all the section, and the cancer came back. The cancer came back. The cancer came back, and I was devastated. I thought, I thought if he took, I thought if I thought if he took, if we are done with the chemo, it would be fine. That was what I thought. I never knew that we are in for a long haul, and I never knew it's going to be an event that is going to redefine my living.
Wow.
And so, yes, that's going to redefine my living, and it does. And the cancer came back, and I actually gave up at that point
Tim.
with the medical treatment, or what that's in 2011. So in 2012, no, he died. No, in 2012. So I I said I'm not going to. He's not going to continue. They told me we did some other tests and they said the cancer is back, so we have to take him. So I said no, I'm taking him out of the country. So why I told you earlier on, we've been online. I've been talking to doctors. I took him to India, and then I took him to India. I took him to India, and then when we got there, it was a different ballgame. India were organized medical tourists. They have a system. At the same time, it's not as if India is, with all apology, it's not as if Nigeria can also do better. Yes, but they were so conscious of the financial aspect of it. And they organize the tourism, they make you comfortable, but they were open. The miscommunication was not there, like what I witnessed in Nigeria, that as at that time, 10 years ago, there was a gap between communication gap with patient, caregiver, and their doctors. So they got there, they told me everything that, oh, this patient you are bringing, the medical report you sent from Nigeria that was telling us that he was stage 2 going to stage 3 is totally not right. What we are saying here is that your husband is far gone and he has few weeks more to live. The cancer has spread and is the stage 4 patient. Misdiagnosis, and my world was shattered. This is a guy that he was my classmate in the university. I never knew what it is to be loved. My mother single-handedly brought me up, and I met somebody who was fantastic, who I could call then was the love of my life. And you're now telling me in India that he has few more days to live. And don't forget, I'm also a Christian, a strong Christian for that matter. Because at that point that he had, even through our trials and tribulation, the succor I got where I could rest on was mainly, apart from my immediate family, was my church, the Fountain of Life Church. And I always say this because I can never forget. Pastor Tyrell of blessed memory stood by me, adopted me and my late husband when there was nobody we could rely on. His own family, maybe just one of his uncle that stood by us. We know what it is when it comes to cancer, and I hope, no, don't let me say I hope. I can see it's getting better. At least Nigerians can now understand that cancer is not totally spiritual, because I have to say not totally spiritual because Nigerians believe cancer is spiritual. So there's nothing you can say cancer is spiritual. So, but now they are seeing the scientific aspect of it, the lifestyle effect, why some of these things will happen to body. So this the church came true for me. And when I said I'm taking him to India, they supported me. Anyway, after all that have been done in India, in India, they were able to tell me the stage he was. They were able to show me a lot of things. They were able to tell me what is happening to my husband's organs. That was for the first time in my life. That was when I understand what it means when they said a patient is in palliative stage, when a patient is in end of life stage, when they said a patient is having water retention, when a patient organs are failing gradually. Those were the things. When a patient does not have potassium in their body again, when my husband became static, but he was alive, but he was static. But he was breathing, but he can blink his eyes, but he was breathing. And I was shocked because I've never seen anything like that. And they called the doctor. What is happening to him? They said, lack of potassium. The cancer has affected his potassium, so he doesn't have potassium. But if I want him to be moving his body, his lips, his legs, his arm, this injection is $2,000. This $2,000 injection will bring him back in the next 3-4 hours. And this one that is $500, we give him, the potassium will start working after maybe 24 hours. That is Indian for you, and that was what I experienced in India. I was asking them questions. They were telling me, though it wasn't easy because I remember that I was passing out. Whenever they tell me he has 1 week more to live, he has this, as at that time he was on wheelchair, he couldn't walk again, and they gave us assistance. Apart from the sole caregiver that followed him from Nigeria to India.
I want to
And
ask you some questions because I don't want us to run out, right? And I know that a lot of this story is in a lot of the work that you've been doing, and some of it has been launched on the website, right? But I want to ask you, and I want us to look at it, very specific things. The access to cancer screening and treatment, as you have just pointed out, is often very difficult. Yes, we are making some progress. We have to give credit to those who have fought the fight to get us where we are. But there are one or two really big barriers that are standing in our way today, especially focusing on colon cancer. What I understand is something to do with, because it's to do with your organ, your stomach, yeah, colon, yeah. So, so I understand that it's if you have things like diarrhea or stuff like that, you have to be careful because if it's persistent, it can be a big problem. What would you say? What would you, if you were to give a Nigerian that don't know anything about it, 2 key things they must consider based on your experience? Because you're not the one that has it. You watched it. And one of the things people don't want to hear is the impact on caregivers.
Thank you so much, Dr. Ejo. We tell Nigerians now understand that when you are stooling, when the pattern of your stool, not even only watery stool, diarrhea, when the pattern of your stool change, you need to get it checked out. And unfortunately for Nigeria, before now, the awareness is changing the narrative. When people are stooling blood, even doctors misdiagnose colon cancer most times because when the doctors see it, they believe colon cancer is the disease of the old. But colon cancer is now the disease of both the old and the young. We are seeing colon cancer in young adults. And what are the symptoms? Some are the symptoms. I'm not saying these symptoms are you. When you see these symptoms, you have colon cancer. I'm speaking from the human angle. And I'm speaking as a colorectal cancer advocate, not as a medical doctor, but from the research and from what we've seen, even from the patients that we've lost, the ones that are still undergoing treatment, most of them were stooling blood at some point, and they were treated. Some of them treat ulcer for a long time, and some people treat hemorrhoids for a couple of months, some for 2 years, some for more than for so many years, and it is colon cancer. Colon cancer is not sudden. Colon cancer starts with polyp, just like when you have breast lump that start like with tom-tom size, and it's became bigger. So colon cancer start from the colon. If Bola Wakitude has done some specific screening, like if he had had a colonoscopy in 2008 or 2007, or even FIT, that's fecal occult blood test, you are bleeding, you can't see with naked eyes, but the test can pick it. That's why if you did not eat vegetable, but your stool is colored, is like kota, grayish,
You know what? I'm going to have to bring you back. I have to bring you back because this your story is very interesting, and it's something that we have to really look very carefully at and discuss. But I want to say thank you for joining me because our time is up, number one. But
Oh wow.
yeah, but it's good because you actually shared your story, which a lot of us did not really know. Even I that I'm with you, I didn't really realize it was like that.
Thank you.
So I want to say a very big thank you to you for joining me today, and I'm having
Thank
you
you.
again. I will have you
Thank
again, so you will come back and explain the other part of this discussion.
Thank you.
And thank you for having me.
So let me quickly put it. This month is colorectal cancer month. The color for colon cancer is blue. So please, everyone, check yourself. Go for your colonoscopy. If you're 45 and above, go for your colonoscopy. Ask question. Nigeria, ask question from your doctor. It is your body. It is your right to ask question. Don't be afraid. Your doctor will listen to you. If your doctor is treating you for ulcer type, hemorrhoids, for 6 months and you are not getting, ask your doctor, can you see a gastroenterologist, a gastrointestinal doctor? These are the doctor for the stomach. Most Nigerians
all
do
right.
not know this.
Thank you.
Thank you so much. And thank you for having me. Thank you.
Thank you all for joining us, and we look forward to seeing you again in the next 2 weeks, where we will have some other patients coming. Children of survivors actually coming on to come and talk again. And together we fight together. And you can join us on our social media handles, and this video will be up on our YouTube channel for you to be able to get the information and have an understanding of what's going on in the cancer space. Our message is very clear. Together we'll fight. Together we win.